we're facing and going to continue to face a significant shortage in the number of available clinicians. This is affecting primary care. It's also affecting specialties. It's affecting nursing, and it's really affecting rural areas who right now are very acutely affected by this. And I think AI, properly employed, can be a huge differentiator in enabling access to care, and do that a couple of ways. I think one is the ability to reduce the administrative burden that existing clinicians are dealing with. And that's kind of the result of, over the last 20 years, 25 years, as we've moved to electronic medical records, we've put the burden of that documentation on our physicians and very squarely on the backs of our nurses. And being able to remove that administrative burden by utilizing properly managed and implemented AI will be huge to be able to allow them to do what they're supposed to be doing, which is really taking care of us, taking care of patients. And I think that's one way. I think the other way is augmentative, and that's this assistive AI that is going to help physicians by giving them advice, by helping to be an extra set of eyes as they're looking at these exams, as they're looking at their images, as they're looking at their charts to identify opportunities to make sure that the patients are getting all of their concerns addressed. Maybe not just the most prevalent ones, but making sure that everything's being taken care of. And I think that's going to be a big differentiator. If you start having to have conversations with the doctors about the triangle of care, and I'm going to keep one eye on the technology, and I keep one eye on the patient, and I'm going to make sure I'm documenting everything, and I don't want to miss anything. The ability for AI to be augmentative in that process, to make sure that the computer goes away from the middle of that conversation to going behind the scenes in the background as an observer, and is there to help be assistive and to track to make sure that things aren't missed. That's kind of a big deal. I mean, if you think about it, no one wants to drive down the road looking at their iPhone while they're trying to drive a car, and that's what essentially we've asked doctors to do for the last 25 years. So moving AI to the background, so it's kind of keeping track, and it's helping you document what's going on, so your whole focus can be on that patient. That's going to be a big deal for our physicians. And I think that's one of the things I look at, is that we're going to enable doctors to really be doctors. We're going to enable nurses to really be nurses.